One of President Trump's top medical advisors is urging the White House to embrace a controversial strategy to control the spread of the coronavirus. According to reporting in the Washington Post, Dr. Scott Atlas wants the U.S. to try herd immunity. It's a model Sweden used that lifts social restrictions and tries to build up immunity among healthy people. However, Sweden has had one of the highest infection and death rates worldwide. Dr. Atlas has since released a statement saying there is no policy at the White House of achieving herd immunity and that he has never recommended it. Dr. Thomas Tsai joins me now. He's a surgeon at Boston's Brigham and Women's Hospital and a professor at Harvard School of Public Health. Dr. Tsai, first, can you just explain herd immunity and how Sweden tried to use it?
Hi, Savannah. Thanks for having me on the show. The idea of herd immunity is that if you have a higher proportion of individuals who have already been exposed and developed antibodies and immunity to the coronavirus, that decreases the probability that somebody else will be susceptible or exposed to the coronavirus by chance. Think of it as, if you're in a room and there's lots of bouncing balls, if you have more of those balls that have antibodies, the individual chance any of those balls hitting you becomes lower and lower. And what some countries have done, and Sweden has been an example, is to say that we can expose individuals and keep the economy open, keep society open, with the idea that more and more individuals will be exposed, and that will increase the herd immunity for the coronavirus. It's a very controversial policy, and most public health experts really worry about, needlessly exposing individuals to the coronavirus unnecessarily.
So would the main concern with other countries trying this approach be simply that we would be needlessly exposing people who could potentially be at risk, even if they might not be in one of those categories that seems it?
Yeah, I think that's right. And there is no shortcuts to fighting this pandemic. There's no miracle cure. We are left with what we had, with the same basket of interventions that we had several months ago. We have wearing masks, good hand hygiene, good public health interventions such as physical distancing, social distancing. Our ability to treat the pandemic has been improved with increased algorithms for care inside the hospitals, and we're still awaiting the vaccines to come. But what we're also seeing is that there's rising numbers of coronavirus cases among young individuals, including, especially the wave in the South over the last several months, numbers of hospitalizations and deaths, even among those who are young. And keep in mind that the United States is not Sweden's population. 40% of our population is obese, which we know is a risk factor. 10% of our population has diabetes. So it's not an apples to apples comparison. And it still comes down to, I think the trade-offs, aren't there. It doesn't make sense to unnecessarily expose individuals when we have interventions that work, that can allow people to re-engage society in a safe and thoughtful way by still wearing masks, still having physical and social distancing.
So now, in your opinion, are those the measures that should be taken by the U.S. to control the spread of coronavirus, or is there anything else?
Yes. So, we have a set of interventions that we know work, and we don't have to just look at Sweden or other countries. We can look within our own country to see what has worked in the past and what will likely continue to work. Think about how widespread the pandemic was in cities like Boston and New York in March and April, with individuals and patients, waiting in long lines and being in very crowded emergency rooms. And New York has had a less than 1% test positive rate for several weeks now. Boston and Massachusetts has a test positive rate of less than 1%. And these are states that have, faced the very high surge of the pandemic, but have used public health efforts thoughtfully with universal masking for all individuals, a very slow and deliberate reopening to focus on safety for our economy and for schools, and continuing well thought out and well planned out physical and social distancing guidelines. And this is an example of we can meet the pandemic, see a peak, and then come off of that peak if we do it in a safe and thoughtful way. We don't have to throw caution to the wind and barrel ahead. There is a game plan that has worked and can continue to work.
So for people who say it's time to reopen businesses, it's time for me to send my kids back to school, it's time to get back to normal, what do you say? What's your message to them?
Yeah, there is no sort of philosophical or belief. All this needs to be driven by what the evidence show. At the Harvard Global Health Institute, we've developed a dashboard which shows the risk level for each state and each county. And really, what the reopening plans for both society and for schools needs to be driven by the number of new cases per day, because that gives you a sense of what the risk level, the threat level of the community level transmission of coronavirus is. In communities where the transmission is very low, let's say less than 1 per 100,000, that's a green zone where you can safely reopen schools for in-person education because the risk of transmission is low enough that the benefits outweigh the risk. On the other hand, if you have a county or a state that's in the red zone with over 25 per 100,000 new cases per day, that's a hotspot. That tells you that there's widespread community level transmission, that you have to get control of the pandemic first. It doesn't mean to shut schools down forever. It means to buy time like we did back in March and April to flatten the curve. But back then it was to flatten the curve to preserve capacity for hospitals. Now we're flattening the curve to make sure that we can get kids back to school safely. We can get businesses back open, but do it in a safe and thoughtful way and still following good guidelines such as wearing masks. The best way to reopen our economy, to reopen the schools, is not to do this thoughtlessly, but to do this thoughtfully by making sure that we follow through with the game plan that works in terms of good public health practices.
All right, Dr. Tsai, tips that we can all use. Thank you so much.
Great, thank you.
Hey, NBC News viewers, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.